of September is National Suicide Prevention Day. And September is the month in which we create awareness about suicide prevention. It's estimated that around 15% of adult population will experience depression at one point or the other throughout the life. And according to the World Health Organization, that means we are staying in a community where we have around 300 million people in the world living with depression. That's insane. Whatever the cause is, for some, it might be emotional pain. For some, it can be physical pain, but it can become too much that they consider suicide as an option of escape. In fact, about 8 lakh people go through suicide every year. And for each of those, there are around 25 times more suicide attempts. There are many factors alongside and include depression and mental illness that influence a person's decision to go through with suicide. The reasons being guilt, trauma, substance abuse, loss of someone you love, and last but not the least, chronic illness. The tragic thing is that many of those who consider suicide don't really want to die. They just don't know how to deal with the pain they're experiencing. And one such condition which causes thoughts of suicide in about 50% of patients is endometriosis. Endometriosis is a disorder in which tissue similar to that forms the lining of the uterus grows outside the uterine cavity. The lining of your uterus is called endometrium, and endometriosis occurs when tissue similar to the endometrial tissue grows on your ovaries, bowel, tissue lining your pelvis, or anywhere else in the body. Endometrial tissues growing outside the uterus is known as endometrial implants. The hormone changes of your menstrual cycle affect the misplaced endometrial tissue, causing the area to become inflamed and extremely painful. Over a period of time, the tissue that has broken down has nowhere to go, and that gets trapped in your body. And this causes irritation, scar formation, adhesion, which binds your organs together, severe pain during your periods or otherwise, and fertility issues, to name some. Endometriosis, a word which most of the people have never heard of, is not a rare condition. It's a common gynecological condition affecting 1 in 10 women. And I am one of them. Symptoms of endometriosis are pelvic pain, heavy periods, bloating, infertility, fatigue, migraine, depression, mood changes, mood swings, pain anywhere, right from your pelvis to your joints, to your bones, anywhere. So endometriosis is a whole body disease which can include any organ of your body. And it takes on an average of 7 to 10 years for most of the women to get diagnosed. There is no way to diagnose endometriosis properly without a surgery. You need a diagnostic laparoscopy to go for a diagnosis of endometriosis. And many people spend years being dismissed. Currently, sadly, there is no cure to it. So experts say that research on endometriosis is extremely low, but few recent studies have shown a relationship between painful chronic conditions and mental illness. It's very obvious, right? Somebody in pain throughout would some way or the other have mental illnesses. There's a research that has been done with women with chronic pelvic pain and endometriosis, and 86% of those women have depression, whereas women without chronic pain have 38% of depression. That's a massive, massive number. Women with endometriosis have been told by the medical community that they are faking it. It's psychosomatic. You are very sensitive. Or they're seeking drugs. And such statements coming from medical community causes tremendous psychological trauma. This gaslighting, which happens in this endometriosis patients in this community, this particular community which faces so much of gaslighting, is a very, very high possibility why such women go through so much of depression, because a medical professional who should actually listen to what the patient is saying are dismissing them. A delayed diagnosis and being dismissed likely contributes to worsened mental health. If you have been misdiagnosed and underdiagnosed for many, many, many years, you certainly can become very frustrated and depressed because nobody believes that you have pain. There's a lot of grief. They feel like their life would have been very, very different if they would have been healthy. Also, because infertility is such a big deal in the endometriosis community, there is a lot of grief about problems around conceiving and not being able to conceive. Chronic pain from any cause has been shown to be associated with depression. This is not surprising. It's not a surprising finding, as anyone who has lived with pain for any significant amount of time will know that social isolation, inability to participate in normal activities of daily life, and sheer exhaustion can lead to feelings of depression and hopelessness. Patients with chronic pain have a 2 to 5-fold increase risk for developing depression, and each condition affects the other. Depression can worsen the perception of pain, and pain can worsen depression. It's a vicious cycle, and the community and the people around patients with endometriosis are the ones who can break this cycle. Furthermore, studies have shown that when the pain is moderate to severe, impairs daily function, and is difficult to treat, it is associated with worse depressive symptoms and outcomes. In general, what happens is pain associated with endometriosis tends to be dismissed by medical professionals so often that it is undertreated. Because it's not believed, it's not treated. And people with endometriosis may not get the emotional and social support that they need from those around them because of the general lack of understanding of the disease and the effects it can have on a person's body and spirit. The need of the hour is the society starts understanding about this disease, understand what endometriosis is. Just because somebody is looking healthy does not mean that they are healthy. It is an invisible disease. It drains you down completely, and it affects you day in and day out. Living with a condition which causes you pain throughout the day is crazy. Imagine having to take efforts to do your day-to-day activity. It's unimaginable. Many of us have been told that our pain is all or mostly in our heads, or is psychological rather than physical. Imagine the despair that can be caused by dealing with severe pain, which is even called worse than a childbirth, month in and month out, or sometimes even every day, and being told by the doctors that the pain was just in your head, knowing it is not, and that without treatment, you will have to live with this pain for the rest of your life. And imagine you losing your job or having your partner leave you because of your disease. It's easy to see why depression turns into hopelessness, turns to thinking you would rather die than live. However, with compassionate and appropriate medical care, the pain of endometriosis can be treated. The pain can be treated with appropriate medical pain management, with diet, acupuncture, and physical therapy. Endometriosis itself can be treated with surgical excision, often with long-lasting pain relief. We need to make all healthcare providers and care providers understand that the severity of the pain that endometriosis can cause, so that the pain itself can be treated appropriately. We need to make all care providers understand the severity of the pain that endometriosis can cause, so that the pain itself can be treated appropriately. And we need to recognize the potential for depression and even suicide, and bring these difficult discussions of emotional consequences of living with endometriosis out into open. I, being an endometriosis survivor and an endometriosis advocate, am hoping to bring about change in at least one woman living with endometriosis. And I hope I'm able to prevent at least one woman from not committing or not contemplating about committing suicide. September is Suicide Prevention Month. Let's join hands to help women with endometriosis and other chronic silent illnesses live a dignified life.